live from the couch.
I tell you, this is a big story, big numbers too. Varicose veins, it's estimated that up to 25% of adults in the U.S. suffer from the unsightly and sometimes painful condition. Katie McGee, though, shows us a brand new procedure designed to banish those bulging veins.
Kathleen Keene has been coping with the pain from varicose veins for 37 years.
The pain, the heat in the legs, the swelling of the legs, and because of the pain, the limping. A really lumpy, like a knot vein, and heat would generate from that. You put your hand on my leg and you would feel the heat. When it was there, it was hard to walk.
Hoping to put an end to the pain, Keene turned to Dr. David Greuner, who developed a procedure called the no-knife endovenous radiofrequency ablation, a minimally invasive treatment that will leave patients without a scar.
Endovenous ablation, and that's been around for a while. Basically, we place an IV or a sheath into the vein that's affected. We thread a catheter up through that sheath, and we heat the vein from the inside out, which seals it, and your body absorbs it. I remove the sheath, so instead of a 5mm incision that you would traditionally use, I had a special laser fiber invented that fits through a traditional needle. There's no incision, there's no scar, and there's no inflammation and minimal trauma.
The procedure is just over 6 months old, can take as little as 15 minutes, and doesn't require downtime afterward. Patients who are dark-skinned or scar easily will benefit most, but anyone with chronic venous insufficiency is a candidate. Dr. Greuner says if varicose veins are left untreated, they can lead to more serious medical problems down the road.
Your skin doesn't like iron, and when blood pools in your leg, iron breaks down and deposits in your skin, which causes ulcers. The other main problem is as these veins get larger with age, they can have clots in them, basically, and they're connected to your deep system. So as your veins get larger, the clots inside them will be larger, and they can communicate with your deep vein system, which could eventually cause a pulmonary embolus or clot going to your lungs.
For Keene, who just finished her second treatment, the pain has already started to subside.
I'm going to be able to keep up with my grandchildren now. It's going to be fabulous.
The procedure is typically covered by insurance, and an interesting fact about varicose veins, Dr. Greuner says they tend to be more painful during the summer and on warm days like today. Blood vessels can get larger to kind of help regulate and maintain body temperature, which forces more blood to the skin, and I did not know that.
Huh, well, something to look forward to with the colder weather coming in, I guess. It's a silver lining.
What causes them?
Varicose veins happen when the veins in your legs have problems getting blood back up to the heart, and several factors can play a role here. Age is a big problem. Being pregnant can cause varicose veins. In fact, it does tend to happen to women more than men. Genetics play a role, family history. And believe it or not, Dr. Greuner said that he sees a lot of marathon runners in his office because of the constant pressure on the leg. And there's not a whole lot you can do to prevent them either. So
that my mom, who delivered 9 babies, that's why she had varicose veins.
Most likely,
and
yes.
They can be really painful.
They can be painful. So whatever you can do to, lessen that will be beneficial for you.
Thanks, Katie.
Thank you.